Dentistry in Turkey, veneers, whitening, and aesthetic fillings. This video is about whitening and improving the appearance of your teeth, what Turkish dentists use to improve your smile. A general video review about how dental care in Turkey is organized we have at this link on our channel, so be sure to check it out. And of course, subscribe to the channel because we have lots of videos about medical care in Turkey. Studies have shown that a beautiful smile not only increases a person's attractiveness, but also affects their self-esteem. Headhunters say that people with straight teeth have better careers because they don't feel any shame about their smile and therefore present themselves better. Some job seekers even take a vacation before an important job interview to improve the appearance of their teeth. Veneers, whitening, and aesthetic fillings come first when your teeth are straight and you only need to improve their appearance. Veneers can hide a range of dental defects, irregular shape, gaps between teeth, and enamel color, but veneers require grinding the teeth, which compromises their integrity. To avoid this, there is an alternative approach. This is teeth whitening. But firstly, it is not always possible to achieve a perfectly even color, and secondly, there are contraindications in some situations. In order to find out how carefully dentists in Turkey approach to determining what can and cannot be done to a patient in different situations, we came to the clinic that Healthy Turkiye works with and met a doctor from Russia. Dr. Elizaveta Chalik came to Turkey in 2006. Here she went through a long procedure of confirming her medical diploma obtained in the State Medical Academy of the Russian city of Perm. After that, she has worked in Turkish clinics in Istanbul, Gaziantep, and Antalya.
There can be relative and absolute contraindications to teeth whitening. Relative contraindications, let's say, include pregnancy, lactation, taking certain medications, certain types of antibiotics, let's say. Absolute contraindications include cracks and chips on teeth, also any weak enamel, and large fillings on the front teeth. This is an absolute contraindication to whitening.
But for those who can still have whitening, what materials and products do you use for whitening here in Turkey?
Teeth whitening procedures. First of all, they can be divided into a system of home teeth whitening. The patient uses it at home by himself, according to our protocol that we give to each patient individually, and whitening in the clinic, that's a professional teeth whitening. In our clinic, we use two systems. One is German and another one is Philips Zoom, the American system. They are certified, they are approved by the World Health Society, so the whitening procedure is always running under control of a doctor. And I can say this procedure is always safe for the patient.
Unlike whitening systems, veneers allow you to completely hide not only the opacity of tooth enamel, but also small violations of the shape of the tooth row and achieve a smooth, perfect smile if the teeth themselves are located correctly. Although the decision to install veneers should not be made without consulting a doctor.
It all depends on the situation. If, for example, there are huge fillings on the front teeth initially, it is also a contraindication to veneers. That is, there is already a full crown prosthetics proposed, and this situation is also a contraindication for whitening. Veneers are usually placed for aesthetics, so first of all, it is very important whether the teeth come out of the gums correctly. But small errors can be corrected by trimming the gingival margin. If, let's say, a person has a slight tooth crowding, in this case too, we can set up veneers. But if there's more tooth crowding, then the tooth should be sharpened more. And how many, it's always important. The less we sharpen the tooth, the better. But if, let's say, we go to the dentin, this is the layer that is under the enamel, then the adhesion that is gluing, sticking of the veneers to the tooth becomes less. So in this case, of course, we do not recommend veneers, we recommend crowns. But also we can do it in a mixed way. Let's say if some teeth have a lot of crowding, you can do crowns and the rest of the teeth can be covered with veneers. That's also a possible way.
Then could you tell us this? A patient who is in another country but knows that in Turkey, for example, he wants to have a certain procedure done and it will be cheaper here. Can he send you pictures of his teeth beforehand, maybe a medical history, so that you could see it and explain remotely, before his arrival, what you can and cannot do in his situation? What are the variants for him?
The first step is that we ask the patient to take, say, intraoral photographs. on the templates that we send him to determine roughly whether he's indicated for veneers or crowns to be made. After that, we ask for X-ray pics if possible. Usually everyone has this opportunity, they send us in advance. So the price and approximate treatment plan we can work out before the patient gets here.
If a veneer breaks off, can it be replaced in another country?
Yes. We give certificates. I work with laboratories that I am sure and I know what kind of ceramics or zirconium blocks they use. Therefore, if it happens to a patient, and sometimes it happens, it's not due to poor quality of the veneer itself, it happens. Let's say a patient has it just with a little trauma, then veneer may crack, then we can tell the patient what block was used in this denture, and the person who is in another country coming to the dentist and tell him that's the kind of ceramic I used. So in this case, the new one will not differ in color from the rest.
Not every clinic uses quality materials. That's what even the Turkish dentists admit themselves. If you have watched our other videos about dentistry, you probably remember these words of the doctors. They emphasize that it is important to make sure of the quality and check out what materials are used in the treatment. Dr. Elizabeth Çelik gives you a hint.
What do you need to pay attention to? When choosing a clinic, when choosing a doctor here in Turkey. I have been living here for almost 18 years, so I know this sector well. It is obligatory. What kind of materials does the doctor work with? That is, what laboratory does he work with in general? Because the quality of the prosthesis depends very much not on the clinic, not on the doctor, but on the technician and the laboratory where the prosthesis was made. So what materials does he work with? Does he work with German ceramics or Chinese ceramics? So it's all going to depend on the quality and the price. I would not recommend running after a low price here.
But how can you check, sorry to interrupt, how can you check
Ask
it?
for a certificate.
To ask certificate from the doctor?
Yes, so that the doctor can provide, let's say, what kind of ceramics he uses. Let's say it could be from the German company Vita. Every laboratory has a certificate for these ceramics or for the blocks, for zirconium or IMEX blocks. And you have to be sure with it. And the price. I mean, there's no cheap German ceramics, it doesn't exist. So the price has to be a little bit higher than the average market price. We calculate the average price in Turkey and go a little higher. Then maybe not 100%, but maybe at least 80% to be sure that really good materials will be used.
To choose a hospital that really uses good materials and can provide suitable service, it is important to know as much as possible about the specifics of different clinics, their capabilities, and how the local healthcare system works at all. That is why a special service company is in charge of organizing the treatment of foreigners in Turkey. Its employees know the specifics of this field.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
The service company can organize the guest's trip on the principle of all-inclusive, from meeting at the airport and accommodation in the hotel to the work of an assistant, translation of medical documents, migration formalities, and even rest between doctor's appointments. With such an all-inclusive approach to patient care, Turkey compares favorably with other countries where you have to pay separately for each manipulation. Healthy Turkey works only with proven medical and hospitality specialists and coordinates all their work for each patient. The company's website address is on the screen. There is a lot of information about other types of care in health tourism. You can use this website as a database on medicine in Turkey. And for consultation, feel free to call this phone number. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.